Well, the dreaded flu season is upon us, and health experts are now expanding their recommended ages for vaccinations. News 4's medical expert, Dr. Peter Ostro, explains.
The push is on to get flu shots, and this year, flu vaccination is recommended for almost everyone. The recommendation for kids has been in place for a few years, and for many, it's an annual complaint.
The kids always come in saying they don't want any shots, and that's a sign of a normal kid. But the influenza vaccine is a pretty easy to tolerate shot.
Dr. Siemens is a pediatrician at the Northwest Buffalo Community Health Care Center. She sees many parents who have questions about vaccination.
Usually when people come in and they have some hesitancy about the shot, we can answer those questions and help them to make a decision that they're comfortable with. Usually they do decide to get the flu shot.
For kids from 6 months to 2 years, the only option is a shot, and those can be painful for a little while. But for older kids and adults up to age 49, there's also a nasal spray that's much easier to take.
All done.
And now is the time.
Getting your flu shot in September will still protect you if the flu doesn't come around until March or April.
Flu vaccine isn't given to children under 6 months, so anyone who has contact with them or with others at high risk should be vaccinated. That's why the recommendations were expanded this year to include all healthy adults aged 19 to 49.
So you're not only protecting yourself, you're protecting your neighbor, your family member, the person you come into contact with in the community. So it's a good deed to get your flu shot.
So by immunizing healthy school children and adults, we prevent them from bringing the virus home to babies or other family members. So you're one of the people who's in that age range now recommended to get a flu shot.
That's right.
Do you ever get one before?
Never had one. I've always been afraid from what I hear from people. They get sick after they get it, so that's always kind of steered me away from it.
You know, that's not really true. First of all, you can't get flu from a flu shot. If it's the first time you've ever been vaccinated, you might for a day or so feel a little bit unwell, but that doesn't happen again, okay? And you can avoid it by getting the nasal spray.
All right. Good advice. Thank you, Doc.